Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Monigle, welcome and thank you for joining us for the Future of Healthcare Brand Experience. In today's webinar, you'll hear insights from Humanizing Brand Experience Volume 8, the definitive brand experience study in healthcare, featuring insights from over 27,000 consumer voices. Here to unpack the findings from the just released report are Grant Mason, Executive Director of Insights at Monigle, and Dave Middendorf, Executive Director of Health, Care, and Wellness at Monigle. Before I turn the program over to Grant and Dave, one quick note. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as we can in the time we have. With that, I'll turn the program over to Dave to kick us off.
Thanks, Daniel, and thanks everyone for being here. I see a ton of familiar faces and just really excited to share all the insights that we've gathered this year. Before I jump into that, I just want to kind of provide the bigger context of where we come from as Monigle and how we think. So behavioral insight is really key to all the work that we do. It drives how we create brand positioning, think about brand architecture, but also culture and experience, where we'll really dive into today and spend a lot of our time. But it's also those experiences that we have in those parts of the work that we do that change how we think about behavioral insight, and it's really fine-tuned the way that we've created our model and the way that we think about applying it. Today, I think just taking stock of kind of where we are, we know it's been a really difficult start to the year. There's a lot of changes happening. There's a lot of challenges. But ultimately, I think what we'll share today is a lot of good news and a lot of things that we can really feel proud of, base where we go on from here. We've built strong foundations. We've got new tools. And I really think it's about, how we're going to address this new reality of doing more together, especially in this space where we actually have to do more with less. So with that, we'll jump into all the different topics we want to cover. You'll hear from both Grant and myself kind of going back and forth from chapter to chapter.
Thanks, Dave. Yes, the comeback continues. Chapter 1, let's dive in. I think the exciting thing is that in spite of the turbulent world we live in, engagement in health and wellness remains high. This is people's personal engagement in their health and wellness based on our index that we have been tracking since 2019. And you can see that it has maintained that same high score of last year. Why is that? Well, when we look at the components of our health engagement index, what you can actually see is that emotional value is still incredibly high, and that's great news for us to see such high emotional value and peace of mind from receiving healthcare services. But also symbolic value is high. People are willing to go the extra mile and pay more for the best healthcare provider. So, this is good news. Engagement is there. The groundwork is there for us. People want good healthcare from their provider. And the good news continues, because one other measure we've been tracking in this study is people's likelihood to delay care. And in fact, delayed care behaviors have fallen to a new low this year of 23%. So people are actually engaging in care again and not putting off care they think they might need. And why is that? Well, because it seems like finally some of those access issues we talked about last year have gone away. You can see that boxed attribute, difficulty getting an appointment when I needed it, was 32% last year, cited as a reason for delayed care. That has dropped to 22%. So I do think this is something we should be incredibly proud of. I know access has been a massive challenge for all of us in recent times, and it seems like we've finally got over that hump. And even more good news, trust continues to recover. We saw 2 years ago, trust in healthcare providers to make the right decisions for me reached a new low. Well, now we've seen 2 years in a row where that's recovered. So again, it seems like all of the attributes as it relates to health and wellness engagement are moving in the right direction. We thought this snapshot would be helpful. Trust does look different depending on what market you're in. So this is people's personal trust in their healthcare providers based on the market they live in the US. So take a minute to have a look at this, find your market. There are some interesting patterns on here. I think in general, The West Coast has more markets that I would say are distrusting of their healthcare provider, but it does vary by market. So please have a look and adapt your strategy as needed. So what does it take to earn trust? I think it's always good to look at the best when it comes to looking for inspiration and diagnosing what trust is. And on this page here, you have the top 10 most trusted healthcare brands according to our latest study. That includes UAB Medicine, University of Iowa Healthcare, Mayo, Duke, UVA, Penn, University of Miami Health System, Johns Hopkins, Bon Secours, and Houston Methodist. So well done to all of you. And in the book, we have a lot more top 10 lists. So definitely take a look at those, which you can download obviously from our site. We thought it'd be interesting though to correlate other attributes with trust to really try and diagnose what trust is and how to get trust. And when we do that correlation with the other attributes in our study, what we find is that it's the perceptions that are emotional in nature that are most critical to that trust connection. So you can see lots of emotional attributes most correlating with trust, although the number one attribute is quality outcomes. And of course, I think if you are known for quality outcomes, of course, that's going to gain trust. But perhaps if you're known for not delivering on quality outcomes, that can also quickly erode trust as well. So we've shared a lot of good news in this chapter. I am going to end it with one bit of bad news, which is that there is a bit of a warning sign in the data as it relates to trust. You can see on this page here that there's actually one age group where distrust in their healthcare provider is actually growing. And unfortunately, it is that youngest demographic where we see distrust going the wrong direction. So yes, in the main, we are improving trust as healthcare systems with our consumers, but there's something going on with that younger demographic that Dave's going to dig into in the next chapter.
Yeah, so let's dig into this. I mean, why do we care about this generation? Why does it matter so much? We've covered put an entire chapter together just talking about them. What are the reasons that trust isn't improving with them, and what makes them fundamentally different than other generations that came before? I think one of the important things to look at is just the numbers associated with this generation, their size. They make up a huge portion of the population, which is growing year after year. Their spending power. These are the folks who are the future of the economy, driving the economy forward, not only in what they spend, but what they earn as being part of your workforce. Not just the workforce, but think about your workforce and who the people are that are making up your teams that are driving customer experience. And so a lot of this also comes down to their mindset. They move with urgency, and they think pragmatically. They're fiercely individualistic, but they value inclusivity, and they really expect to be able to shape the world around them. It's a different mindset, obviously shaped by the world that they were brought up within. And like Grant mentioned, when we look at their actual levels of distrust, nearly half of them distrust their healthcare provider to do the right thing for them. And one of the things that we uncovered last year when we looked at how trust was built with this generation, that really the fundamentals to building trust were empathy, kindness, but that responsiveness and transparency. So responsiveness and transparency, I think, are really key here in being able to hear what they're saying and respond to them accordingly. And we have to ask ourselves, are we actually doing what we can to build trust with them? Are we thinking about this generation as our actual consumer? Maybe not in some cases. But meanwhile, they're actually more engaged than any other generation out there. When we look at those engagement metrics across a different generation, they're top of the charts, right? They're out there looking they're getting that emotional value. They're setting goals. They crave innovation more than any other generation. But I think the thing to keep in mind is that for them, innovation isn't necessarily the big, robotic surgery or some sort of technical breakthrough. It's more about the technology that might exist in their smartphone or their apps that they're using that helps them get better healthcare, stay well, get care faster, but also holistic care and that holistic value of mind, body, and spirit. This is something that's top of mind for them. So really, with these guys, it's really about, rethinking and expanding the role that you play in their lives and being able to show them that value you provide at every interaction. And as I mentioned, goals, right? They're the most goal-oriented of all generations. And when you look at the goals that are top of mind for them, it's different than other generations. They are, they're thinking about increasing their sleep. They're prioritizing mental well-being. That's something that really stands out, and I think it has to change the way that we think about the type of content, the type of communications, the way that we actually engage with them. And so, some of their words and some of the open ends that they provided, just thinking about their health and wellness, is they want clear explanations of how to achieve their objectives. They want someone out there to help them, and they're really today feeling like they're not getting that. So I think here's the ringer is that their expectations aren't being met today. So no wonder there's trust issues. They don't really feel like they're being listened to. They don't feel like they're being treated holistically. They're not getting practical advice for their daily lives. Those are all things that are super important for them, and they're not feeling like they're getting enough from. So we know this generation is incredibly busy as well, and we're just not moving fast enough for them to meet those needs. So when we think about just the checklist to how to engage with Gen Z, it really centers on ideas like proactivity, knowing and understanding that they're coming to the table with having already done some of their research and actually meeting them where they are. Topical interest, making sure that we know what's interesting to them and connecting them to the content and the places that they're going, recognizing their personal goals and helping them actually achieve them and actually track their progress towards achieving them. And again, that holistic value. How are we, not just there for them when they're sick, but actually helping them through their wellness journeys. We talked about innovation and thinking about not just the new kind of healthcare technology, but the healthcare support technology, meeting some of those pragmatic needs. And then influence and advocacy. Does this generation see people like themselves showing up in your communications to them? How can we take some of the super fans that we might have created in this generation and leverage them to help tell your story?
Thanks, Dave. So on to the third chapter. We're now, of course, going to talk about AI. And I know you're thinking a chapter about AI in a series called Humanizing Brand Experience. Surely not. But we went there and it matters. And we're not just doing this because, we want to jump on the AI bandwagon. There's some really interesting insights as to the role AI can play. I think the first thing that's really important is that AI really has the potential to fill this growing consumer self-serve behavior we're seeing in our data. Proactivity is on the rise, and whether we like it or not, 3 in 4 people are now self-serving care. So you can see that based on the data here. And who is the generation most adopting AI already to do this? Of course, it's our Gen Z audience. They are the folks who are out there trialing AI and using it. So 1 in 3 or nearly 1 in 3 Gen Z has already used AI to diagnose or treat a health condition. So why are they going to the robots for help? What's going on here? Of course, the number one reason they're trying it is because they're curious. They're a curious generation who loves technology and they just wanted to try it. So, I think it's really interesting to see the appetite for AI, especially given how challenging healthcare is to navigate in real life for these folks. So it's not surprising they're experimenting with it. What's really interesting, though, and what we're most excited about, is that AI is not currently and may never be a replacement for in-person care from a professional, but it looks like Gen Z aren't really using it as a substitute anyway. They're using it more as a complement. We're actually seeing that, in a way, AI can help break down the barriers that this generation is facing, specifically the lack of time. That busyness mode of this generation, it seems that AI actually delivers on that. Fast advice, fast recommendations, helping people find a healthcare provider in network and with appointment availability, all at their fingertips. But the really surprising insight, and I actually think this may be the biggest insight from the entire book, is that people find AI easy and clear to understand in how they're helping them understand their health conditions. This is really important and something that I would argue we've failed to do forever. AI is breaking down the complex language of healthcare in a way that Gen Z can actually understand and action from it. I actually think this is perhaps where we can learn the most from AI. You know, how to communicate with patients in a human way that's easy to understand and can help them with action on the back end. Lastly, the things that Gen Z are turning to AI for are the things that traditional healthcare is failing to help them with, like their mental health needs. You know, this is one of the major use cases we're seeing displayed for AI currently. And a bit of a sidebar on insurance here. I'm going to go back to that barriers slide we showed you earlier in terms of why people are delaying care. And this time we're going to talk about the issues with health insurance data point. Unfortunately, the insurance as a barrier to care is only increasing. It seems to be getting worse, and consumers have noticed. Obviously, this is a massive issue for us. The fact that insurance is also the main reason people switch providers is something we should all be concerned about. But guess what? Consumers see AI as the answer to that as well. Really interesting how people actually think AI will make insurance questions and navigating insurance a lot easier too. So just another way that AI is helping to break those barriers to healthcare that have always been there. So kind of in summary, it's ironic really, but AI actually has the potential to make healthcare feel more human. What we're seeing is that AI is finally cracking some of the biggest pain points that we've just accepted in the industry. Like I said, consumers are using it more as a complement and to overcome these barriers versus a direct substitute for care. They're using it for faster answers, quicker access, easier navigation of options, clearer communication than they're even getting from their healthcare professional, and that judgment free whole health support, especially at mental health care.
So it's super exciting that AI is actually helping healthcare become more human. The good news, though, is that right, they're not replacing the human interaction, and that's really what this chapter is all about. Is that human interaction and delivering brand experiences across the entire spectrum of the ways people experience and engage with brands still has value, right? That's the fundamental kind of use case and premise of the humanizing brand experience model is that when we actually engage people more holistically across their experiences, that it drives value in terms of who they're going to choose, who they're going to recommend. And, our model shows us again that people really do matter. So when consumers think about people, having the best people is actually the top intellectual driver of choice. It's also on the other side of this chart, the number one correlated driver to HCAHPS. So having the best people and the perception that you have the best people is clearly an important driver to growth, to choice. Another interesting variable is that we call it the other people that they talk to, the other best people are the buzz, the positive buzz that they hear word of mouth from the people around them. That's actually the number one sensorial driver. So when people believe you have the best people and they're hearing from their people around them that you are a place to go, then they're more likely to choose you. We've also learned in the culture research that we do that having the best people is actually a driver for attracting and retaining employees. So people want to be surrounded by people that they think are really good at what they do. But when it comes to the critical moments in the healthcare journey, it's that people interaction in those interactions of people who are delivering care that's most important for having that positive experience. We know that there's so much work and effort that goes into driving people to this sort of hero moment, right? Our product is care delivery, and we want that moment to be as positive as possible. So our consumers see that too, that when they're in that moment, in that room, getting care, interacting with someone who's delivering it, that can really be a make or break moment. But what about improving experiences? Well, this is where it gets really interesting because, we tested a whole sort of set of different things from, different perks like hospitality perks, having beautiful spaces that don't feel clinical, uh, activities, concierge style services. None of those things compare to just having a consistently friendly and gracious staff interaction. That's what people want. It's the humanity. It's that compassion, that level of interaction that people are getting when they're having that healthcare moment. This consumer said, it's the way you are greeted and taken care of as soon as you enter the doors. That's what's important. I need to know that I matter. But I think this is a really good opportunity to really reflect on what we mean by experience. And, experience and brand experience specifically has been so siloed in the past, right? Thinking of this sort of trickle-down view of, brand really being a marketing communications thing that would then flow into culture, eventually into operations, and then eventually out to our touch points. And I think on the right side, when we think about the pressures that we're under today to do more with less and the interconnected world of experience that we live in, we need a different language and a different set of tools for actually talking about experience that isn't so monolithic. What do we actually mean by experience, and what are the different experiences that we try to create, and what outcomes are those experiences driving? So we call this model the living system of experiences. And it's made up of 5 unique experiences that each have a specific outcome that they drive, where customer experiences really drive engagement across the entire funnel of engagement. Employee experiences are there to drive motivation, right? We need people who are motivated and ready to deliver the types of experiences that we want our patients and consumers to have. User experiences are all about driving ease. So I know technically we've historically talked about UX as something more technical or digital, but user experiences can even be, having great wayfinding signage or just having a simplified brand architecture so people can navigate you. Service experiences are more of those human interactions that really drive satisfaction in the interaction and the brand experience. And then finally, hallmark experiences are those things that really stand out because of their memorability. And again, one of the important things to point out here is that experience in this framework is not monolithic, and it's not just the job of marketing. So I think you can all look across this spectrum and realize, the partnerships that you need to form across your organizations to be able to deliver these experiences that ultimately have that impact on the brand experience that we're trying to create. This year, we wanted to dive into some of those hallmark experiences. What are those things that are actually creating memorability? And the thing that stood out was the interactions with people. Again, this is the chapter on human interactions matter most. And we wanted to take this opportunity to also say, we spend so much time and effort thinking about the actual, patient or customer experience that we try to design. And oftentimes we forget about the people who are actually going to have to deliver those experiences, our employees. And the context that they're coming in is, they're under so much pressure. And a lot of the work that we do often just adds another thing to their plate. So this is just another call to action to rethink your orientation to how is the employee experience, the culture design aspect of this, a crucial part of your strategy to deliver the consumer experience that you want to create. Because again, from what we're seeing, it is those human interactions that matter so much. We also want to go back to some of the things that we mentioned last year, which were these keys to the future. We'll talk about each of these, but really here we want to focus in on listening as being just one of those, clearly human-related things that can just go so far in the relationships that you build with consumers. So going back to that slide that I just showed about those memorable moments that stand out, again, one of those top moments was just having people that listen to their needs. So I think, to put that in context, we said, what was the most memorable thing that happened in your healthcare interactions last year that impressed you? And it was simply having someone listen to them. So a huge opportunity, a huge way for us to connect our brands to people through, just not making people feel rushed, giving them undivided attention, allow them to ask questions and give them meaningful responses. That's really what's standing out. So it's all about connecting on a human level and listening to the whole story. That's really going to help meet those expectations of the future.
So we just refreshed you on one of those 3 keys from the future that we talked about last year, listening. There are, of course, 2 more that we want to delve back into, and the first one is wellness. Wellness is the why. Now, think about that for a second, because one of the biggest mistakes we see clients making is to message about sickness. We as an industry actually obsess about chronic service lines, and real people just don't want to think about that. In fact, no consumer wants a relationship with the brand that is focused on sickness. And there's some really interesting quotes here about the importance of wellness to people and that growing mindset, as you can see. Um, but what really interests consumers and where there's an opportunity is brands that keep them well, that sets healthcare goals with them, that takes a more holistic approach to managing their health. Now that's an interesting proposition, and it's backed up by this incredible stat of this growing global wellness economy that is projected to be nearly $9 trillion by 2028. And if you still don't believe us that wellness is important, I'm going to pull back out our HCAPS analysis that we've shown in previous iterations. It's incredible, but wellness, based on all of our attributes, is now the second most correlated attribute with HCAPS performance after best people. And that's actually up 25 ranks from the last time we did this analysis back in 2020. So you can see how, as a trend and as a key for the future, how important wellness is, not just to appease consumers, but actually you're going to get better satisfaction scores too if they believe that you deliver on this. I think it's important to call out that wellness is multifaceted, right? It's not just about physical health. And we actually did a question this year where we broke out those different dimensions of wellness. It's really shocking, but the younger generations are the ones who are struggling with their well-being the most across the board. You can see that with all the green coloring against the Gen Z column here. They actually rate themselves lower across these different dimensions of well-being than other generations do. They need our help, and I do think as an industry, we need to redefine what we do to really deliver and support the needs of this next generation. In a way, the exciting thing about wellness is that as an industry, we suck at it, right? Why is that exciting? Because it's white space. It's something that's incredibly important to consumers, and yet we're not delivering on it. In fact, consumers rated their healthcare provider lowest on these attributes that relate to their wellness expectations above anything else. So this is a moment where we can step up as leaders and really deliver on an emerging need for that next generation. And as we've seen, a way to actually build trust and address that growing distrust with Gen Z that we showed earlier as well. So how do we feel this need for wellness? Well, it starts with the themes we've already discussed, listening and goal setting, right? Actually, those are both very important aspects of having a good holistic relationship with the consumer. But it also requires health systems to open their minds to integrating health data from the apps and wearables that consumers are already using today. And it's incredible when you actually look at the vast amount of apps and wearables that the younger generations are using to help manage their health and wellness. Let's work with the tools they're already using in their own ecosystems and add our expertise. That's where we can really add value and what people want to see from us. But also, what does that mean in terms of adjacent services? Honestly, it starts with evolving annual checkups to wellness check-ins. A simple nomenclature shift that the industry is well overdue. But it's also about presenting more options for things like meal planning and nutritional advice, micro habits, mindfulness practices, sleep hygiene, mental health resources. I mean, these are all of the wellness behaviors we're already seeing displayed by those younger generations on their own. Let's help them with these things. And I also think wellness is an incredible opportunity as a hallmark experience when you think back to that framework for the living systems that Dave showed you earlier. And honestly, no one does wellness as a hallmark experience than Parsley Health. There's a reason why, yet again, every single year, Parsley Health is the #1 disruptor brand and the best brand based on our model. But other brands are doing wellness too, delivering really unique hallmark experiences that are both salient and transformative for their healthcare brands.
I did want to answer one question Mandy posed just going back to the idea about Gen Z compared to the silent generation in their terms of well-being, is the criteria different for Gen Z? And I do think their criteria is different. I think they have high expectations, but that doesn't mean we shouldn't try to meet them. So I think there is that huge opportunity of understanding what those expectations are. And the way that you get closer to building trust with them is to at least show that you're trying to deliver on them. So with that, we do want to talk about, if wellness is the why, then personalization is really the how. It's the pathway for us meeting consumers where they are. Um, when we kind of going back to this chart one more time, personalization is actually the third most correlated driver to HCAP score. So again, there is that business, driving potential of being able to drive that personalized experience. But also just go to back to the personal nature of what we saw in the engagement index, where 76% of people say that receiving care brings them peace of mind, right? There is that incredibly personal nature of getting and receiving care. And when we look at the actual care experience, we live in this world where personalized medicine is a thing, and we know it's driving results for people, but that's in only niche service lines or very specific cases. And consumers' broader expectations, more on this kind of personalized side of medicine, really isn't being met currently. They don't feel like they're getting it. But I think the thing that we need to be real about is that, changing the way that care is delivered isn't going to happen overnight, right? We're not going to be able to completely transform our systems to deliver personalized medicine at every level or completely change the way that we drive wellness. But we do need to think about, again, what are the things that we can do? And so really what makes personalization the how for us is the content. That's something that we tend to own as marketers, the stories that we tell, and our consumers are out there engaging with content, especially content on social media. It's a huge opportunity. They're there. They're already starting to consume our content. They're watching reels, they're liking videos and reels, they're following content creators. This is a place that we can engage even more. And especially with those younger, harder to reach audiences that we're trying to build trust with. This is a place where they are even more than our other consumers. But I think we need to be really clear about, what is it that they're looking for? What's the content that they're actually engaging with? What do they care about? And again, they care about wellness content. They want to know about fitness and nutrition, healthy habits, mental health. These are all the things that are top of mind that they're more likely to engage with versus things that range more to the clinical side, whether it's clinical trials or health research and health technology or specific treatments. It's more on the wellness side of content that they're going to be more likely to engage. And when we look at the sources that people are engaging with and want to engage with, it's really the doctors and clinicians. This is where they want to get that content from. So it's just a huge opportunity for health systems to really leverage their greatest asset. We know that trust really resides in those provider relationships. We know that we can take our most authentic and engaging personalities and leverage them to help tell their stories, help get out there and connect with consumers, maybe more so than wellness influencers or lifestyle influencers will ever be able to. And so just a consumer quote talking about, the type of content that they engage with is this pediatrician who is down to earth and shows short videos about yes and no things to do regarding children's health. They'd be interested in seeing more short preventative care videos like that for adults. So we know there's a ton of ways to level up your content right now, but I think the first things that we would do is really making it personal, right? Using digital tools that let them build their own wellness plan, really customizing the content that we're creating to, where people are, their goals and their challenges. Like I just said, turning experts into influencers, get those doctors out there, those ones that can quickly build that rapport and can be those personalities. on social media versus creating polished social ads that people are probably going to be more or less likely to engage with. And then, be where they are. Go to those platforms, be on TikTok, be on Instagram, keep it short, keep it punchy, and make sure that content that you create really fits that platform. Think about educational tips around fitness, nutrition, healthy habits. And then ultimately think about segmentation. Use this segmentation as a tool to your advantage. So you're actually connecting the way people think to the types of content that you're serving up to them.
Yeah, thanks, Dave. That's a nice segue to the last chapter before we get into the model and the rankings. So, from our perspective, if wellness is the why and personalization is the how, and Dave just walked you through the fact that content is a really great way for us to kind of get into personalization within the control of marketing. Segmentation is the tool that allows you to make the personalized content a reality. That's how we see the role of segmentation in healthcare. If you go on to the next page, obviously this is our segmentation. This is the segmentation we've talked about in previous iterations of Humanizing Brand Experience. But the reason we are so focused on this segmentation solution is that we feel to deliver personalized content that feels human, you have to know the person behind the condition. Segmenting based on their needs, not based on their demographics, the psychographics are what really matter to build that human relationship and to deliver really personalized content. Now, this is an abridged version of what's in the book. We're not going to go through all of the details on the segmentation today. If you would like a deep dive on our segmentation, we're happy to do that as a follow-up meeting. Please just reach out and let us know. But high level, I'm just going to walk through who these 7 segments are as a quick reminder before we talk about what's changed this year. The wellness influencers are one of the most important segments because they are super engaged in their health and wellness, big on their wellness management, and actually they're one of the groups who are most likely to spend the most on their health and wellness, but also talk about it and share about it. So if you recruit them, if you engage them, they'll become an advocate. They'll actually pull others into your brand due to that influence they have and passion for health and wellness they have. The habitual strugglers, they're obviously the complete opposite from the wellness influencers. They typically have chronic conditions, but most importantly with this group, they are struggling to manage their health on their own. They need our help, and they're kind of stuck in a pattern of behaviors that they can't get out of. So actually, this segment is one of the segments you will likely see as a regular patient. They need a lot of support, and specifically, they need support in terms of how we talk to them. It's not just support with their condition, but it's actually emotional support as well. The positive preventatives have a really positive relationship with healthcare. They're one of the most trusting segments when it comes to their healthcare provider. And frankly, whatever you tell them to do in terms of checkups, in terms of preventative care, they'll do it. They see healthcare as a tick list and they're very proactive in what they do. The great thing with this segment is they do it with us. They're not going to self-serve care. They're actually going to use that provider relationship to manage their wellness and stay on top of their health. Whole health managers, however, are a really interesting segment because they're highly influential, much like the wellness influencers, but they do not trust us at all. In fact, they're one of the most distrusting segments. It will not surprise you, they're also one of the younger segments, and they actually tend to self-serve care more than anyone else on this page. So they'll do their own research, they'll proactively look up symptoms, they'll use Dr. Google, they'll then turn to more holistic solutions for their health and wellness. And then they'll come to us for a last resort because they just do not trust that we have their best interests at heart and will jump too quickly to medication. The trusting traditionalists are exactly that. Whatever we say they'll do, they're very trusting. They've likely had the same doctor for the last 30 years, but they are aging out of the population. They are one of the older demographics in terms of segments on this page here. So really important that that mindset is shrinking. The unapologetically unhealthy are one of the most disengaged segments in terms of health and wellness. They really do not place any emphasis in their lives on diet, nutrition, exercise, or regular checkups with the doctor. And for that reason, they tend to be a lower priority target. Certainly, they will engage with us when they really need us, but they are just not that engaged with their health and wellness period. And then lastly, the Dr. Lodgers are a really interesting segment. They're another young segment. And what we find is that they're also one of the most diverse segments in terms of ethnicity. They also tend to be a slightly lower socioeconomic background as well. So really interesting group. The doctor dodging behavior comes from the fact that they just have too many barriers to care in their lives. Oftentimes, it's because they have children, they're time pressed, and actually making their own health and wellness, it just can't be a priority in their life compared to juggling jobs and juggling family. Actually, if we can break down some of those barriers to care, they would engage. You know, they are engaged in health and wellness. They do value it. They just can't always access it due to the constraints in terms of time, insurance, money, etc. Okay, so that was a high level recap. This is a look at the size of the segments and how they've changed in the last couple of years. And again, it's really exciting. Similar to that category engagement story we walked you through earlier, we're seeing a shift towards the healthier, more engaged segments this year. Wellness influencers now actually make up the joint largest attitudinal segment in the US population for the first time. You can see that habitual strugglers and wellness influencers each make up 19% of the population. And whole health managers, who are another influential engaged group, saw the largest growth in the last year. Of course, they're also very distrusting of us, so we have to work out how we build a relationship with that segment. And like I said, those trusting traditionalists, they continue to shrink over time. In fact, they've now shrunk down to 10% of the population as they age out of the population. So you can see that existing trusting mentality slipping away based on that segment. Also, the good news is that the doctor dodgers are also shrinking. Thinking back to those barriers to care we showed you earlier, the fact that access is improving, it's actually helping to reduce that doctor dodger mentality as well. The last slide I am going to show you on the segmentation before we get into the model and the rankings is really how these segments overlay with generation. You know, we've talked a lot today about Gen Z and their needs and what makes them different. But we don't want you to fall into the trap of typecasting a person just based on their age. And you can see, even with the Gen Z group, there is a mix of mindsets, even within that audience. And sure, there are some interesting patterns on this page. And clearly, as you look at the silent generation and boomers and how they fall out across the segments compared to Gen Z and millennials, there are obviously some emerging segments that are very different among those younger generations. But again, it's not a one size fits all solution. And that's why segmentation is so important. You can't make assumptions about who a person is based purely on their age. Okay, we're now going to get into the model and the rankings for this year. Quick recap of how we actually evaluate brands in this study. So when we measure brands in our study, what we're doing is we're essentially evaluating brands across our framework, across 50 plus different attributes that really understand the drivers of brand choice and advocacy nationally. Quick note on this year's model, it has not changed. In fact, the model is incredibly consistent in the last 4 years. The model produces a single brand score based on the SEM approach, and that brand score is actually 74% predictive of consumer behavior. If you get a good brand score in our study and rank highly, you are going to drive consumers to choose your health system and recommend it to others. Now, in our model, there are 4 key dimensions and a whole range of attributes that every single brand is evaluated on. And subscribers of the study can actually see how they score across all of these attributes. But in terms of the drivers by each dimension, those sensorial drivers really haven't moved much in the last couple of years. Dave mentioned this earlier, but word of mouth buzz is absolutely one of those key metrics as you're thinking about the sensorial elements of your brand. In terms of the more intellectual functional drivers, best people remains number one, followed by quality outcomes and empathy. And again, not a ton of movement in terms of the importance hierarchy across these drivers. Interestingly, the emotional drivers did change. So the emotional drivers is all about how we make people feel and whether we deliver on their implicit health and wellness needs. And you can actually see that freedom has jumped up into the number one spot this year. Freedom is about how we make people feel in terms of having options when it comes to their healthcare. And clearly there's a trend that that's becoming more important than ever this year. And then the final set of drivers is related to the behavioral dimension and what people do with our brand inside and outside of care. Again, fairly consistent across the drivers, although making my life better, that idea of enhancement has actually jumped to #1 this year above positive interactions. All right, that was a lot about the model. Let's reveal this year's best brands based on our study. So this is it. This is the best of the best based on our brand model, the most human brand rankings for 2025. University of Iowa Healthcare, they did it again, 2 years in a row, the #1 brand in the US. Big congratulations to them. Fantastic for performance. Followed by UAB Medicine. They have been up and around this position in the past. They've been second in the past. They were third last year. Continue to be a top performing brand. Johns Hopkins Medicine has to be one of the most consistent performers in our study over the history of the study. They're almost always in the top 5. So this is not a surprise to see them at third, followed by Mass General Brigham holding on to 4th spot, and TriHealth jumping up into the top 10 for the first time. So some really strong momentum behind that brand. Bronson's back in the top 10 in one of their best positions they've seen. And then 2 of the biggest movers up into the rankings this year were Penn Medicine and Houston Methodist. You can see they've jumped up into the top 10 for the first time. That's followed by Ohio Health, the University of Kansas Health System, Emory, University of Utah Health, and Baptist Health South Florida, rounding out the rest of the best brands on this page here. Now, we'll go through these brand lists pretty quickly. I want to give you folks a chance to look at them and to potentially find your brand. I'm going to call out some of the biggest movers as we flick through these pages. I think, first of all, UW Medicine jumping up 41 ranks is really impressive, from 69th last year to 28th this year. UVA also jumped up 32 positions from 61st a year ago to 29th. Hogue is another big mover, up into 31st position. NYU, another big mover. Memorial Healthcare System has also jumped up this year, as has Mercy Health Hospital and Crouse Health. All big movers year over year compared to where they were a year ago. Some other big movements for Tampa General, Hackensack, one of the big movers up on the list. Berlin, Northside, in fact, is the biggest mover this year, up an incredible 58 positions from where they were a year ago. Atrium Health, Sharp, Aurora, UF, Baylor, Wellstar, all big movers year over year. As we go down on this page, again, there's been some nice improvements for St. Elizabeth Healthcare, up 18 ranks. Wake Med's gone up. Atlanta Care, one of the other big movers, up 42 ranks this year. RWJ Barnabas has also gone up, and Conway's seen some good improvements too. And this is the last page now. So this rounds out the rest of the rankings. We'll give you a chance just to look at this before we jump on to those biggest mover rankings. Okay, so top 3 new entrants this year, they are Vanderbilt Health, University of Tennessee Medical Center, and St. Tammany Health System. All new brands in our study, all coming in and around the top 50. But the top 10 biggest movers, some of which I just listed off, are Northside, Hackensack Meridian Health, Atlanta Care, UW Medicine, Maine Health, Houston Methodist, Sharp, RWJ, UVA, and Memorial Healthcare System. These are the biggest movers year over year. Well done to all of you. And then finally, a shout out for our disruptor brands. Even though we don't put these folks in the main rankings because they offer a slightly different model of healthcare, we want to call these 3 brands out: Parsley Health, Maven, and Kindbody, because year after year, they continue to score even better than our #1 ranked brand in our study. So Parsley Health really is the best of the best according to our model and the relationship they have with consumers.
Thanks, Grant, and congratulations to all those incredibly high-performing brands, and especially those ones that have made big moves this year. Just to close us out, we wanted to think about implications and takeaways, and we're going to do it through the lens of the different experiences that we talked about. So, the first one, really thinking about those hallmark experiences, is be stickier, right? How do we actually stand out in the minds and the memories of our consumers? And there's a lot of tools for us to do this, right? We can boldly express our identities. So, understanding those key attributes that we have that can just really stand and stick out in their minds. But, some of the things that we talked about, wellness being a hallmark. How can you incorporate some of these emerging trends, things that are important to consumers, and stand out on those things in interesting and experiential ways? The second, going back to one of those three keys of the future is really making it personal. So when we think about customer experiences, we need to think about them across the entire cycle of engagement, not just each separate touch point that they might engage with or just key touch points, but how do we move them through our experiences and really create loyalty journeys that are built around their lives, the way they live, not just our products and services and our service lines. Personalization, another great way, thinking about segmentation, using content, getting the right type of information and content in front of people at the right times and places. Leading with humanity. Talked a ton about this. It's called Humanizing Brand Experience for a reason. This is all about, again, making sure those human interactions are doing their job because we know that they matter most. And they're really key to building that satisfaction and trust. So listen first, right? Listen and then act with empathy. It sounds so basic, but it's that thing that is, driving so much trust. It's stood out in the minds of our consumers as being memorable. Think about goals as part of the conversation. What are people's goals? How are we helping them track them? How are we helping people meet them and get them to those goals that they're trying to be easier. User experiences are all about making things easier, and there's a variety of tools that we can think about leveraging here. There's new tools, but there's old tools as well. Think about your brand architecture. Think about your signage. Think about those things that make it really easy to get people to where you are. But then also think about AI and how that's going to be part of the strategy to get people to your people faster and break down some of those barriers. And then last, but I think most important is don't forget your people. The employee experience is going to be key to delivering the patient experience that you want to create. So start there, figure out how to create those cultures, create those ways of working that are going to help operationalize those experiences that we want to create for consumers. And even really rethink about wellness as an internal strategy. How are you delivering wellness to your people so that they can deliver it to your consumers? And if you all want to join the movement, if you want to see your data from this year, if you want to be included next year, if you weren't in this year's study, reach out to us. Continue the conversation. We're happy to dig into your data from what we've had previously and move forward from there. And now I think we have some time left for some questions.
Absolutely. So I'm going to pass this first question to you. This is one of the questions that was submitted ahead of the webinar. We're in the pediatric behavioral healthcare field with lots of competitors. How do we differentiate our brand to referring providers and patient families? So I'm going to pass that one to you, Dave.
Yeah, I mean, I think it's really about knowing what your strategy is and who you are, that's core, because I think that level of authenticity is going to be incredibly important. We also do something that we call brand mapping. It's research to understand, where do consumers perceive you to be? What are your strengths and what are those strengths relative to the competition? And I think that's a way to tie back to those things that people actually care about that are driving the decisions that they make, but then also are authentic to you that you can actually deliver on or work in the near term to improve on as you move into that brand positioning.
Absolutely. And one of the questions in the chat says, what do you think University of Iowa is doing that set them apart the most to get for the first spot? And I can answer that because I've spent a lot of time looking at their data. I think the answer is it's everything we've just gone through today. As you think about all of those drivers, all of those different ways to position your brand and deliver on people's needs. One of the things that University of Iowa does really well is they're not just a big AMC that is pushing best in class clinical messaging. They're actually talking to people in the community in a very human way. They've built strong relationships and they're also delivering effective marketing. They're highly visible in the community, strong partnership strategy. We spent a lot of time talking to them about how they have effectively grown even their equity year over year, despite being number one. So I think to be on that top 10, top 13 list, actually, you have to be meeting all of those different needs across the intellectual, the emotional, the sensorial, and behavioral spectrum. Because, yeah, you can't just do one thing well. You actually have to do a lot of things well to get onto that top 10 list. Another question that came in the chat, and I'll give this one to you, Dave. In my experience, healthcare has been reticent to evolve their marketing to embrace new channels and platforms. This appears to be a call to do just that. How do you or we convince leaders to invest in these approaches and decrease traditional efforts?
Yeah, so I think what we all know is that change in healthcare is hard. Healthcare systems are big. We're not the fastest moving institutions. And so I think the key here is more of a test and learn approach. I think you're not going to be able to shift your entire marketing strategy overnight, but if you can carve out the tests to do it, whether it's in a specific location, market, service line, whatever it may be, get those tests out there, see how they're performing. And especially the new channels that we're talking about, the data is more clearly there. You'll have more to go off of. You'll learn more faster, and then be able to start building that case for broader change and investment.
Absolutely. And then one last question, and I can take this one because it's a fun question and it's not the first time I've been asked it. Do you find that audiences respond better to campaigns featuring real people versus illustrating motion graphics? So this is a question I've had before in healthcare, and I think we've been asked this because of the emphasis on best people and humanity and how important it is to center communications around humans. I actually don't think it's a simple answer though, because as you think about your campaign strategy, and even in my experience, there are trade-offs from these two visual styles. Yes, if you have real people and here are real people, that does help show the people. It shows the empathy, it shows the human connection. But there's a lot of campaigns in healthcare that all look the same, with the same montage of doctors helping patients. And what ends up happening is that can actually make it hard to cut through and make it hard for that creative to be ownable. And actually, sometimes motion graphics animation can be more salient, it can be more ownable, it can help with cut through. But yes, conveying the humanity without those beautiful shots of real people is harder with animation, but it can be done. And I've worked on some very strong animated campaigns in the past that have done just that, even in healthcare. So yeah, I don't think there's one or the other. They come with pros and cons that have to be considered when you're obviously making those creative decisions. So I know we're at time, and I just want to thank the forum for hosting the session today, and thank you all for listening patiently as we went through all that data. There is a link in the chat to download the full report, so please do. There's much more content in the full book. And with that, I'm going to pass it back to Daniel just to close us out today.
Thank you, Grant and Dave, for such an insightful and thought-provoking conversation. We really appreciate your insights, and thanks also to everyone who tuned in. We're glad you could join us for such an important discussion. Please note that if you asked or submitted a question that we weren't able to get to, we'll do our best to get a response to you. The forum will also be sending out a link to the webinar recording in the next few days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, and check the forum website, healthcarestrategy.com, for details, and mark your calendars for the 31st Healthcare Marketing and Physician Strategy Summit, May 4th to 6th, 2026. We hope to see you in Salt Lake City. That concludes today's program. Thank you and have a great day.